Bismillahirrahmanirrahim. I am Dr. Sayyid Raza Mohyuddin, member of the Visiting Faculty, Times Institute, Multan. And this is the 12th lecture on health system analysis, health policy and health planning. And today we will discuss the health sector reforms. Health sector reforms, as you all know, that what is the meaning of a reform? Reform being a positive change. And this health sector reform, this implies sustained, purposeful and fundamental change to address the needs of the commitments for provision of equitable healthcare services. So as already told you, that the definition of the health system, in the basic, it is the basic commitment of all governments to provide equitable health care to the public, to the people of the country. So health sector reforms, this implies the sustained, purposeful and fundamental change to address the needs. So you must remember three words: sustained, purposeful and fundamental change, considering the health sector reforms. And now, how we can define health sector reform? Health sector reform is a fundamental rather than an incremental change which is sustained rather than one-off and purposive in nature. This is another definition I already told you. And this health sector reforms include improving the performance of the civil services, decentralization of power and resources. Already while teaching the devolution, I told you the devolution and decentralization, and then improving the functions of national health ministries. Then is the broadening health financing mechanisms, introducing managed competition and privatization. This concept is according to Kessels. Then the current interest in health sector reforms are that is in the developing economies, they, like the population growth, increasing poverty, unemployment, volatile socio-economic conditions, and is the brittle governance. This happens in the developing economies. This is the condition. So what we have to do, this leads to inequitable healthcare access and lack of social protection. Due to all this, the population growth, poverty, unemployment, and the bad governance, this leads to inequitable healthcare access and lack of social protection. That is, why the health sector reforms. Then the overall objectives of health sector reforms are to improve the health status of the population through provision of equitable, affordable and efficient quality healthcare services. Not only the simple healthcare services, but equitable and affordable and quality health services. So you have to remember the points: equity, good governance, community participation, sustainability, quality assurance and efficiency. Then health sector reforms for fairness is connecting equity, accountability and efficiency. So when you will connect equity, accountability and efficiency, this will be health sector reform for fairness, and equity in the service is required for social justice and fairness. And equity means both equity in the services and equity in the financing. Whatever the customer or patient A is getting in the services or the um, type of service activity containing the finances, the patient B, C, and D must also be having to the same things. That is what's nowadays is a famous. We don't see the face, we see the case. So we have see the condition, the illness, and the solution must be provided to all categories of people. Then is the accountability. This is the it is requirement of the justice because we have fundamental interest in fair governance. So also instrumentally important to efficient, equitable delivery of services. If there will be no accountability, there will be no fairness, there will be no equitable service. And the third one is efficiency, and this, the efficient systems always they get better value for money in meeting needs under resource limits because you have got scarce resources as per economics, and you have to complete your program. You have to provide the services within the same finances, and that is efficiency. You have to give the better value of the money you are being provided, and this requires integrated focus on equity. So goals, this equity and goal, they works together. Then are the what are the scope and guiding principles for health sector reforms in support of result based management. This is the bridging the gap between health policy and implementation. It is the evidence based decision making through decentralized health management. Already I told you in devolution and decentralization, the last lecture. Then is the provision of cost effective and affordable quality healthcare service, and then is the improving equitable access and coverage. Then is the addressing local needs and solutions through community participation. Community participation is very necessary because there are problems prevalent in certain areas which are not prevalent in the other areas. So you have to look the community needs, and then is the achieving improved health status. By all that you can achieve the better health status. Now, with all this, context of the health sector reforms, now our interest for in our country, we have to see what is the health system in Pakistan, and then we can, see what are to be corrected and what reforms we can take. So, the health sector of Pakistan, there is a federal government, there is a provincial government, then Ministry of Health in the federal department, and then is the provincial health department. The Ministry of Health of the federal department is responsible for planning and formulating national health policies. So in the last government in 2010, the when the 2008 when the devolution of powers were done, the health were transformed to the provinces. So at the national level, there are certain things which are left, like drug regulations and some national policies. So most of the burden of the health provision has been on the shoulders of the provincial health services and the district level services. So provincial health is, although the responsibility for implementation rests largely with the provincial government. Then we are seeing it is the what the characteristics of health system in Pakistan. These are complex and a mixed health system. There is on one side, already I told you when I was teaching you the basic concepts of health system, there is one publicly financed government health system, and then is the private health system, from the paying from the pocket. Then there are four tiers of public sector. First is the outreach and community based services. Then is the primary care facilities. Already, you know, this outreach and community based services are which focus on immunization, sanitation, malaria control, maternal and child health, and family planning. And you all know the departments which work on it. Then primary care facilities, they include basic health units, BHUs, rural health centers, RHCs. These are mainly preventive, outpatient, and basic, inpatient care. In RHCs only, inpatient care. Then the third is the secondary healthcare. This includes the Tehsil headquarter hospitals, district headquarter hospitals for patients, then inpatient and also specialist services are available. Then is the tertiary and specialized care. These are hospitals. These are located on the major cities for more specialized inpatient care. And there are the teaching hospitals, and some are the, in tertiary care, there are some non-teaching hospitals as well, and specialized care hospitals. Then you see in Pakistan, the private sector in healthcare is varied with no defined structure and weak regulation exists in this sector. There is no, proper and you can say effective legislation for the private sector in the form of like fund fees and services and all that. So they all are the autonomous in all types. There's health, this healthcare commissions are involved, but there are still lot have to be done. Then the private sector is primarily a fee for service system. You have to pay for the service. Each and every service you have to pay. Then the private sector is, providing, there are regular hospitals, nursing homes, centers, clinics, informal structures, you like these, there are certain stores doing all this, and then NGOs, then is the Unani, homeopathic, and peers, hakims, and all that. There's a lot of people, everybody is, providing the private healthcare service. Then in the allopathic services providers are, these are qualified MBBS, then are specialists, then they are semi-qualified, but they are qualified for their own specialized tasks like LHVs, LHWs. Then there are non-qualified like dispensers, PNs, chowkidars. They are also, while in the small centers, they are, involved in the healthcare services. And in the non-allopathic service providers are the homeopaths, hakims, pehlwans, acupuncturists, already I told you, peers and hakims and all that. Then in the like the provincial health departments and the federal government hospitals and the district government hospitals, there are other public sector departments. They are involved in health sector. This is the PIA hospitals, Pakistan International Airline hospitals, railways hospitals. Then is the employees social security hospitals. Then is the WAPDA hospitals, the Baitul Mal hospitals, others Pakistan telecommunication hospitals, Fauji foundations, almost all the big cities they have the hospitals. Then there is a long chain of armed forces institutions and even the teaching hospitals and medical colleges. So, what are the problems in the Pakistani health sector? It is basically it is inadequate. Number one. The second is it is underfunded, and it is mostly focused on urban areas, especially the, you can say, curative, focused on urban areas. With the rapid population growth, the facilities are not expanding proportionally and as desired. So, since the last 2 years, have you seen any new hospital? No. Have you seen any new ward? No. I'm talking of the public sector and in Punjab and other areas. But there are the news that the hospitals will be established, and you can well calculate the population increase in the last few years. So, inadequate underfunding and only urban focusing and the establishment not according to the requirement. Then, so if you just, see the major problems, they are inadequate funding, lack of health facilities in rural areas, then there are unemployed doctors and other medical people, then acute shortage of doctors and trained medical personnels. Then one very important is brain drain of medical graduates. Lot of the medical graduates, specialists, they have moved to Saudi Arabia, England, and other countries. Then again, hammer on the head of the public is the increasing prices of medicines. In the last 1.5 year, I think the prices have increased about 30 to 35% of the life-saving drugs and others. And then is the circulation of fake and spurious medicines. In the area where I live, I have seen the medical factories. One of my mates, she said she is working in a medical factory. And if you have seen that area, it is covered, you can't find a gate even. So the medicines are being manufactured in colonies and all that. With how these are being done, who is the supervising all this? There are no comments. So these medicines are being used by us. Then about the inadequate funding, in Pakistan, the government spends less than 1% of its GDP on health sector, which is one of the lowest in the world. And it, it may be 1.1%, 1.2%, but it's mostly less than 1%. And this results in limited allocation of personal requirements and infrastructure. Then about the rural areas, the 85% of practicing doctors are found in urban areas. The rural areas, you know, have been left for the quacks and semi-qualified or non-qualified persons. And because of this, the discrimination against rural inhabitants, so because they are also the bona fide citizens of this country, but they have been deprived of to get the quality, or you can say equitable healthcare. And then since the dominant classes live in cities, the best facilities are also located in the urban areas. Then in this scenario where food to petrol everywhere, fire of inflation has engulfed the poor man, you know, the common person has been, trapped in the vicious cycle of unemployment, not having the basic requirements, as mentioned in the Maslow's hierarchy of need, the food, shelter, education, family. Then, another with inflation and the increased prices of commodities and the food items and other things, you know, this with, those people with money can afford the health only. The poor man can't afford the private healthcare, quality private healthcare. Then the poor are they face so many other hurdles as well. And 62 million, this is the old, calculation, are living in poverty, and they are even unable to meet the household healthcare expenses. Then is the, you know, around 5,000 doctors are coming every year in the field as per PMDC, the health the graduates from Pakistan and other countries. And a quite healthy number of women graduates are not practicing. When a WMO, woman doctor got married, she leaves her profession. And some, leave the profession in between. They can't go to rural areas. So this is one of the reasons. Then there is a shortage of lakhs and thousands of doctors, and the ratio of doctors to nurses is 3 in 1, and the international standard is 1 to 3. And in government hospitals, each doctor examines more than 100 patients daily. Not even the MOs in the sitting in the outdoors of BHUs, RHCs, THQs, DHQs, or in the teaching hospitals. The number is, in OPDs, the doctor examines more than 100 patients in 5 hours or 6 hours, and you can well imagine how much time can be given to a patient. And even the specialists, they examine more than 100 patients in the outdoors. So you can well imagine the quality of care. And the international standard in one day, in one sitting, maximum are the 25 patients by a medical doctor or MBBS doctor. Then another is a reasonable number of physicians, they are, gone from the pool of practicing physicians because, lack of security, poor compensation or remuneration, they are paid less. So because if they're unmarried, they join the job and then they get married, you can't run your family in 40, 50,000. So they leave the job and they adopt the private career or whatever they are pulled outside. Then there are limited resources of professional development, and the overall discouragement of health professionals in Pakistan. This is all, the doctors are being governed by the bureaucrats, and you all people have seen the pictures that the bureaucrats visit the hospitals. The qualified doctors, nurses, they are, standing in the line, and then of the protocols of the politicians. So the people sometimes are just they got rid of that. So the pool is, becoming less. These are all, problems faced in the health sector. Then about the fake medicines, WHO report says around 30 to 40% medicines are fake in Pakistan, tourist medicines. I think this may be more than that. Then is these medicines that you don't say these are like, Panadols or are the small medicines for flu and all that. The medicines up to cancer, and you have, there was a times there was a story about uh, these cardiology stunts, which were, fake and understated. You look at the price of a person spend lakh of rupees for that stunt and for his heart, for his life saving, and they are, being given the wrong or substandard stunts. And what you talk of up to the cancer medicines, these scandals are there. And in Pakistan, there are thousands of registered pharmacists, and then there are from the pharmacist number of pharmacists in this country, 25 to 30 times more there the medical stores and dispensaries they exist. So this means that from only one person out of 25 to 30 stores is a pharmacist. So being the drugs are being handled and distributed by non-pharmacists, and this these medicines are not even these fake medicines are produced in small cities. They're produced in the major cities of Pakistan. Then we will see all this is the status of health system in Pakistan. Now, what is the status of health sector reforms in Pakistan? So Pakistan is very important, strategically located in the southern east region and sixth in the terms of population. So 35 to 40% population they live beyond, below poverty line, and the total health expenditure is 16 US 16 per capita, and 9 times increase in unemployment since 1971. And now, due to Corona and all that, this unemployment level has increased. Lakhs and lakhs of, more than 50 lakh people have become unemployed. So this only 20% population utilizes public health facilities, and 80% goes to private hospitals, that is, they pay from their pocket. And the financial allocation for health is 0.88% to some 1 or 1.2% of the GDP for healthcare. One of the smallest amount in the. So if you see, we see the indicators of healthcare. These are all below, and we are on the indicator side. We are some more than 100 level in the world. So very poor condition of the health indicators. Already I told you the issues of problem. The health sector reform is the equitable health services provision, and for this the WHO specified healthcare infrastructure of BHU, RHCs, and hospitals have been established. Then good governance, the district governments have been formed, and as per the national policy, the qualified DHOs with public health experience and knowledge has been applied. There are also some issues and gaps already, and you can say there is, not the effective implementation of the devolution policy. There is lack of clarity and roles. There is a lot of ambiguity in the roles, and there is limited capacity of the staff to just cater with the change. Then another objective of health sector reforms were improving health sector financing. So a certain, you know, the GDP level increased from 0.72% to 0.88%. Now it's about 1 point some percent. So gradually, the commitment to increase the healthcare allowance to the from the GDP is being increased, and the target is 2% of the total GDP. It was by must have been 2% up to 2010, but not achieved. And then, so regarding the figures, I don't, you know, go to figures because mostly uh, the figures provided by the government and actual figures they differ. But the main thing is that the these systems, health system is underfunded, and even does not meet the previous population. It doesn't match the cushion, the increased population growth. Then is the improving regulations of health sector. So health regulatory bodies and these, blood transfusions, organ transplant regulations. I already told you, due to devolution plan and the powers being given to the provincial government, still the centralized policy which was to be made by provincial government is, under mentioned. Then HSR agenda, health sector reform agenda for Pakistan was to strengthening of the developed district health system. Then was improving the governance of, you know, district health governments, etc. And then was the allocating the, funding for strategies. Then strengthening the government's approaches to private healthcare sector. So these were all with there were points, this agenda for health sector reforms in Pakistan. And devolution was one of the agenda. I already gave a full lecture. Devolution, the most popular reform defined as transfer of resources, functions, and authority from the center to the periphery was the devolution. And this is set to support local bureaucrats to better adapt to local needs and demands. So the devolution was supposed to improve efficiency, quality, and utilization of services. Then is the strengthening of the district health system, is the strengthening the capacity of the district health department and linkages among the district health services through express mechanisms for sharing information, knowledge, and skills for the public health practices. Then it was this introduction of purchase provider split between DH, district health development, and district health institutions, or so the different district health officers and DHQTS for delivery of cost effective healthcare services were being. And then the idea of public private partnerships in districts were flown. And then there was the quality assurance system in all the tiers of healthcare systems were adopted. Then is this referral system is in the district developing. There was referral guidelines were given, and then the health services packages you were, and all types of delivery system was given. So then it was the necessary manuals and guidelines were successful, implementation were provided. So role of provincial health department is was capacity building, coordinating healthcare delivery, policy into planning and guidelines, national programs, technical support, regulations, and monitoring. So then there was the uh, proposed HSR agenda for good governance, and that was to develop operational policies for different management components. And then was the about the procurement and supplies. So for the this was, for the procurement of supplies, the current protection, this criteria, etc., and regulatory mechanisms were to be adopted. Then there was supposed to develop operational policies for financial management, for assets and logistics, and for service delivery. Then for good governance, there were the agenda, the performance was a major topic, and this was the performance of the district health system performance to, they were supposed to establish benchmarks for every, and then there was institutional performance. So there was institutional guidelines and manuals and evaluation against the pre-test targets through uniform criteria and standards. And then there were individual performance, review of the existing systems, ACRs, etc., and then linking performance with career mobility and development. So this will also do because it is, if if your performance is better, the promotion, your transfer, your posting will be dependent on the your performance. So this was a type, a part of the performance abilities. Then in the alternate, another agenda item was alternate funding strategies for health, and these were the cost sharing. So this was to strengthen existing financiation schemes in the districts. They were, extension and expansion of the users charges already. Then the cost sharing for drugs, public private partnerships, prepayment schemes, and hotel services, etc., and then provide necessary support to implement and testing the interventions. So there were, you know, this another strategy was to cost recovery. So that was to grant financial autonomy to tertiary or DHQ hospitals through phased approach with gradual reduction of public's, subsidies. There's also a capitalistic, opinion that so the expenses of the government on these hospitals may be reduced. So the idea was to expand hospital financing by linking with, schemes, purchase provider split, and other cost recovery mechanism to, and that to strengthen the district headquarter hospitals to become the last, end referral centers. And then there was to provide necessary support to implement and testing the interventions. So this then there was a strategy and alter for alternative funding was the cost pooling. So these were the health insurance schemes. The introduction to community-based health insurance schemes for public sector employees, and social health insurance, and then the necessary support to implement and testing the interventions. And then another agenda item was regulation, and for this, the provide regulatory and legislative support for public and private health sector regulations. And for this, we were supposed to identify and address the gaps in public and private health system regulations and to develop consensus and implement legislation. Then in this regulation, there was to strengthen the capacity of district health development system and to enforce the legal standards in public health practices. So that was to develop new tools and instruments for food, drugs, standardizations, licensing, and quality assurance regulation, and to strengthen the laboratories and equipment used for regulation of quality assurance like DTLs, chemical examiners, etc. So now we can conclude that for health sector reforms, we say that these should be sustained and evolve through continuous process. Then institutional development and capacity building is key to success. More resources should be made available for the reforms, and reform strategies should be regularly reviewed and adjusted according to country context. Now, the other influence for the health sector in Pakistan, there are, that is for like we must increase the number of health facilities, and then we must take the in consideration the different indicators for the life expectancy, and the for the safe access to water and sanitation is the primary health care we must look for. And you know the then we have to see the utilization of public health care facility for the equitable facility. And then is the funding on the healthcare systems. The health budget must be increased. It's up to for healthy living. And then is to overcome uh, the problems. There must be good governance and poverty reduction. Good governance on the organization side and poverty reduction, so that the people are also able to pay for their health. And like this, so then also is to reduce the burden of diseases. The actions must be taken. And there must be the regulation of the private sectors. Then uh, the there must be some national health policy is there. The gender matter of the equitable health, especially the gender equality must be sought. And the urban bias in providing the health care must be stopped. The urban and rural both areas must be having the same healthcare facilities. And last but the not least is there must be improvement in the awareness of healthcare in the public sector, or and then is there must be very good and effective control on the drug side. And then the healthcare services, the access to healthcare services must be made easy. And the all the deficiencies in the governors and managerial at the district health level must be removed. And by all this, with the increased investment, good governance, the drug control, so the target must be to promoting the healthy living. And this was all about health sector reforms, health system in Pakistan. And thank you very much.